Live picture of the White House, 7:27 on this Thursday morning. The CDC now has updated its website to say claims vaccines do not cause autism, well established, actually are not evidence-based. That's according to this new webpage that reads, studies have not ruled out the possibility that infant vaccines cause autism. Studies supporting a link have been ignored by health authorities. That's the new claim on the CDC website. There also is a notice that the Department of Health and Human Services is launching an assessment into the causes of autism. The webpage previously said studies have shown there is no link between vaccines and autism. HHS Secretary Robert F. Kennedy Jr., of course, long has been a vaccine skeptic, but he did promise in his Senate confirmation process the CDC would not remove language saying vaccines do not cause autism. Let's bring in MS Now medical analyst Dr. Vin Gupta. Dr. Gupta, good to see you as always. So what exactly is on this website, and what's the impact of the CDC now officially putting this out?
Well, Willie, you beautifully teed it up. It is now claiming that, or is putting into skepticism this notion that somehow vaccines may cause autism. That's what they're implying. There is no evidence. There was just for your audience, there was a 1998 article that proposed a link between vaccines and autism, childhood vaccines and autism, that has been serially debunked, as you pointed out. And we know what's causing it. We've had this conversation before. It's genetics, it's family history, increasing paternal age, air pollution. There's little conversation on the actual proven drivers here, and that's unfortunate. But I think ultimately what this means for all of us is that we can't trust the CDC anymore. They are not a scientific or public health authority.
Wow, that's kind of stopped me in my tracks. We cannot trust the CDC anymore. Obviously, Bobby Kennedy Jr. has made a career in recent years of vaccine skepticism, suggesting these links that you have just kind of debunked again here today. What do you expect to happen? Because now you have the official word of the United States government saying, be careful, parents, with those vaccines.
Well, Willie, they've been recommending that people engaged in shared decision-making, pediatricians and moms and dads for their kids across the country. My wife's a pediatrician. I talk to pediatricians all the time. They, previously what was recommended by the highest body in the land for public health, now there's vague recommendations at best, and that harms the ability to actually effectively communicate on these topics. In what is a 15-minute visit? How many things can we add into that 15-minute visit? We all know this. There's a lot to focus on. Here's yet another thing that they're adding to the plate of doctors and parents. It's just not sustainable.
And just, Dr. Gupta, put a fine point on this. Is there any new information that you're aware of, or that any official pediatric organization, anyone, has come into that there is a link somehow between the vaccines that children have been taking for generations and autism?
No, and if in fact, the best way to describe this for parents out there is we've designed vaccines in such a way that we're asking less of our immune systems. Actually, they've gotten to be so good, so effective, that we actually are asking less of our immune systems now than we did 30 years ago. And so if anything, vaccines have improved. Their safety profiles really are impeccable. And we're asking less of our immune systems to give us protection than we did, say, 30 years ago. So absolutely not. There's no new evidence here.
Another big topic, Dr. Gupta, for our viewers, healthcare premiums. Millions of Americans now bracing for those to go up when those tax credits from Obamacare do expire on December the 31st. Obviously, this has been at the core of the conversation around the government shutdown that lasted more than a month. There is one proposed solution by Republicans, which is health savings accounts. Can you kind of explain what that means and what it would look like?
A lot of folks that are in high deductible health plans, so you have to put in a lot of money before your insurance kicks in, that deductible there. For those individuals that have that, they have an option of putting money into a tax-sheltered health savings account. Well, and this is what Senator Rick Scott, this is what the president is referring to now. They're saying instead of extending the premium tax cuts for those that are getting their health insurance, these exchanges set up by the Affordable Care Act, 24 million people, by the way, we're going to send you a check and you can invest it in a health savings account. I think we have a graphic for your viewers here just to show the how people utilize this. For those that make less than $50,000 a year, Willie, very few people take advantage of a health savings account. The majority of people that take advantage of a health savings account are those that make $200,000 or more. And frankly, the vast majority are those that make $1 million or more. So this is something that benefits the wealthier. Certainly doesn't benefit those individuals, Willie, that are being most impacted by the lack of extension of the enhanced premium tax credits. This is not something that's going to cover a hospital stay, $2,000 or whatever they're proposing to go to a health savings account. So you're going to hear a lot about this in the next, few weeks to months. I've seen a lot of social media on this. Health savings accounts are a regressive policy. They do not cover catastrophic health coverage. They are not a replacement for extending subsidies to afford health insurance. And they are regressive. They benefit those that are wealthier.
And this is why you're hearing not just Democrats, but now many Republicans in Congress saying the solution is to extend those HSA subsidies before they expire at the end of the year. MS Now medical analyst Dr. Vin Gupta, appreciate your clarity on this stuff always. Thank you.